So this is your setup for taking alginate impressions. We have the two trays. This is a mandibular. It has the cutout where the tongue would be. This is a maxillary, and this is where the palate would be. You have your scoop, which you will measure your alginate in the container here. You have your water increment vial that you measure the water. We're going to be doing 3 increments, so our water will be up to the top line. And then we will do 3 scoops of the powder as well. I already have my water pre-measured in the cups here. Again, your green bowl spatula to mix. You're going to be putting your impressions in the bag, so that's why I have that there. And then an extra cup of water to smooth out the impression before we place it in the patient's mouth. Prior to taking an impression, you always want to do a visual exam of the patient's mouth first. So you want to take a look, make sure they don't have any removable appliances, any missing teeth, any tori or anything like that. So now I'm going to take the maxillary tray and just try it in before I even do the impression. So you're going to take with your left hand, hold the cheek out of the way, and then with your pinky, hold the other side, go in sideways, hold the upper lip out of the way, and you're just gonna seat that there just to make sure it fits, it covers all the tooth surfaces, it's not too tight. So that looks good. We're gonna do the same thing with the mandibular tray on the bottom. Go in at an angle, keep the lip and the cheeks out of the way, make sure that seats down, and that looks good. For mixing your alginate, you're going to take your container, you're going to give it a little fluff here just to, sometimes the powder settles at the bottom of the container. Set that down. I have a scoop in here already, so to measure, kind of like measuring flour, you're going to take your spatula, tap that and level it off, and you're just going to dump, that's 1 scoop, we're going to do 3. And 2. And then the 3rd one here. So 3 level scoops. I have my pre-measured water, 3 increments of the vial, which I got prior, and you're gonna just pour that into the alginate. So slowly at first, stir, just getting all the powder and the water mixed together. Once that starts getting pretty well mixed, you're going to take the bowl and hold it at the back of between your thumb and your index finger. So that way you can use the palm of your hand to really have a flat surface to smush the material, and you're going to kind of give it a quarter turn. See how it's getting on all the sides, and I'm just kind of pushing nice and firm with the flat side of the spatula. If you have any that looks like it's falling out of the bowl, just take the edge of it, get it all so it's nice and creamy, what we call homogeneous, nice and creamy. For maxillary, which I'm going to do first, we take all of the alginate on the spatula, load from the posterior of the tray, and you're gonna bring that forward with your spatula here. And this consistency is like a yogurt pudding, and that's what you can kind of explain to your patient if they've never had an impression done before. You just want to make sure that it covers and goes all the way around the border of the tray. If you don't have any tray showing. With alginate, you want to make sure it's nice and smooth, not the material isn't too runny where it's dripping down the posterior, because if you put that in the patient's mouth, they are going to gag. With your extra water, just take your finger and you're just going to smooth and make kind of like a little trench up in the anterior. Push that there. If you have any extra, you can just wipe that on your bowl. All right, so now we are going to load our tray. Again, with left hand, hold their cheek out of the way. With your pinky on your right hand, you're gonna hold the other side. Seat the posterior or the back of the tray first. And then you're gonna slowly bring it up. And I want to stand behind my patient. The nose of the patient and the handle should be in alignment. So they should be centered with each other. And then you're just gonna hold the tray in here for about 40 seconds or so. Okay, it's been about 45 seconds. You're gonna keep holding the tray. Just give it a push with your finger to make sure it doesn't indent and you know it's nice and set. Again, make sure that there wasn't any material that flowed to the back of the throat, otherwise the patient would have been gagging. You want to keep your patient upright in the sitting position. You wouldn't want to take an impression with them laying back in the chair. All right, to remove, you're going to come to the side, keep holding the handle. You're going to release the pressure in the back first with your index finger. So you're going to pull with the handle and the back corner at the same time, and then just releases. Then you take the impression out. Make sure there's no voids or air bubbles. You have a nice roll around the border here. And then we would take a damp paper towel, which I have two, one for the lower impression. All right, and then you're just gonna wrap that so it doesn't deform or anything, and you're just gonna keep it until you can pour it up in the stone in a baggie with the damp paper towel. All right, so I have my mix for the mandibular, the lower impression, about ready to go here. Just making sure it's nice and smooth. No powder pieces that aren't mixed together. So for the lower tray, you're not gonna take all the material at once. You're gonna do this in increments. So you just take part of it, load from the inside of the tray, and then take another increment, do the same thing on the other side, and then the rest of the alginate you can fill up in the anterior, the front of the tray by the handle. Again, just make sure there's no voids or areas that don't have enough material. Take your excess water and just smooth out the alginate before you place it in your patient's mouth. All right. So for mandibular, you're going to come from the side, have the patient open nice and big. You're going to go in sideways, and again, make sure you seat the posterior first. And then keep that lip out of the way as you seat down in the anterior with the handle, and then you're going to hold under the patient's jaw here with your thumb and then your index finger up on the top of the tray. All right, it's been about 45 seconds, so we're going to go ahead and remove the impression. Go ahead and hang on to the handle, and again, you're going to go to the posterior, lift up with your index finger in the back as you lift up with the handle, and then it releases. Turn it sideways to take the impression out. Have a look, make sure there's no voids, make sure you got all the teeth and they're present here. Looks good, and then you'll take your damp paper towel and you just want to wrap that up until you are ready to pour it up in stone, because it can distort if it doesn't stay wrapped up in a towel here. So we'll set that aside.